Hello everyone, I'm Richard Conway reporting from ACR 2020 for Room Now, and I'm joined today for an interview by Dr. Sinead Maguire to talk about her study, Pregnancy in Axial Spondyloarthritis, a systematic review and meta-analysis, which was presented on Sunday in the poster session. It's abstract number 1323. Thank you for joining us, Dr. Maguire. Can you tell us first why you did this study?
Sure. So I think it's an important area to cover because typically at the time of diagnosis, most women with axial spondyloarthropathy will be in their childbearing years. And pregnancy is a major life event for any woman, but for women with AXPA, it comes with a lot of extra questions and concerns. And when you look at the research that's already been done in this area, unfortunately, there's not a clear consensus in terms of our pregnancy outcomes in AXPA associated with more pregnancy complications or fetal complications, and what actually happens to disease activity during pregnancy. So because this is an area that I think is very impactful for our patients going through pregnancy, I put together this systematic review just to pool all the research that's been done in this area to try and see if we could pick up true prevalency trends to inform our patients going into pregnancy.
Fantastic, and that's probably going to become even more important with hopefully the improvements in the diagnostic delay and diagnosing people earlier when they're even at a younger age, and particularly in women. And can you tell us what your results showed?
Yeah, so our primary outcome was looking at pregnancy complications in AXPA, and the most significant outcome that we had was actually looking at was in cesarean sections. And so AXPA pregnancies had a much higher prevalence of cesarean sections compared to control pregnancies. And this was significant even after we broke it down into emergency and elective cesarean sections. And you might say, well, the prevalence of AXPA of cesarean sections is rising globally, and that's for lots of different reasons. But what we did show is that despite that, there still is much higher prevalence of cesarean sections in AXPA compared to controlled pregnancies. And then on top of that, there also was a trend towards a higher prevalence of a number of other complications, including intrauterine growth restriction, preeclampsia, and then also preterm birth on sensitivity analysis. We also captured prevalence of fetal complications, and all the complications that we actually captured in our analysis had a trend towards a higher prevalence in AXPA pregnancies compared to controls. Disease activity was a little bit harder to capture, but we did find that a very high proportion of AXPA women experienced active disease during their pregnancy. So these results certainly are a cause for concern and very much a call for research, further research in this area so we can understand why is this happening, what can we do to address this a little better, and how do we inform our patients about this? Yeah.
That's fantastic. It's really, really interesting results, and very, as you say, very important to bring that all together. What do you think the next steps are in this area?
I think first and foremost, it's going to be getting more research in this area. And I think one of the best potential resources for this is going to be looking at large registries, because they are a way to get information, a large volume of information very quickly. And I'm actually doing work with the Ankylosing Spondylitis Registry of Ireland, and we have developed now a section on pregnancy as part of our registry. So for all women being entered into the registry, we're now capturing information on pregnancy in terms of pregnancy and fetal outcomes, breastfeeding, just to get more information on this topic for our patients. So when we sit down and we have conversations with our patients, we can say, this is data from our own population. But using registry data also means that we have a large volume of clean data. So it makes it easier to compare between different registries. So hopefully that will help us to better understand this area and hopefully help our patients in this area much more.
That's fantastic. Thank you very much, Dr. Maguire, and thank you everyone for listening in. Please remember to log in to Room Now for more coverage and updates from ACR 2020.